Are you having aches and pains, maybe headaches from tension at the back of your base of your skull, shoulder pain, knee pain, low back pain, quad pain, hamstring pain, really any type of muscle pain at all, then dry needling might be a therapy that you should consider. However, there is a lot of, confusion about dry needling. A lot of people don't really know what it is, why we use it, how it works, what makes dry needling different from acupuncture. So in this series of videos, I'm just going to try to kind of highlight this therapy, why I use it here, why it's so effective, and then kind of differentiate it from acupuncture, where a lot of people get it confused with and think that they're kind of the same thing. So this first one, we're just going to go with what is dry needling. Dry needling is essentially, we're just inserting a spike, a needle into the muscle tissue itself, deeper into the muscle belly. All that does is that's just creating a little bit of damage to that tissue, which forces the body to send blood flow to it, right? So we find this dysfunctional tissue, we damage it, the body sends blood flow, that helps it to relax and calm down. Sometimes you'll go right through a trigger point or a knot, just help that muscle to relax. Basically, the goal is to get the body to heal itself and prevent this dysfunctional tissue from staying dysfunctional and limiting your movement or leading to compensation patterns that develop over time. The needles that we use are very similar to acupuncture needles. They are about the same thickness, but they're quite a bit longer because they're actually going deeper into the muscle tissue itself. Acupuncture needles usually go in just a couple millimeters, and acupuncture is more about balancing energy levels based on Chinese philosophy. Acupuncture can be really good for conditions like insomnia, asthma, indigestion, things like that, where you're just having trouble processing something. I haven't seen acupuncture be super successful with musculoskeletal disorders such as, rotator cuff injuries or sciatica and things like that, and I prefer to use dry needling. The needles themselves are just these really thin kind of filament needles. See if I can get that to focus. So the needles themselves are just these, and this is two different sizes of needles. See if you can get those in there, but these are just different needles for different areas of the body. So this one over here, this kind of longer one, we would be using more on thicker muscles like your glutes or your quads, low back. And then this one over here would be more for muscles of like the neck. You can tell that the needles, they have no hole in them, right? That's where the dry needling name comes from, that we're not injecting and we're not withdrawing anything. The needle itself is dry when it goes in and it comes out. And because of the nature of the needles being really more of a spike than kind of an injection type needle, there's really no blood involved. Occasionally you get a drop of blood that wipes away pretty quickly. Sometimes you get some small bruising, things like that. But for the most part, dry needling is very, very safe, can be very effective for loosening up all those tight areas and treating some of those deeper muscular injuries.